For the IM injection, I'm first going to gather all the correct supplies, and then I'm going to go in the room, introduce myself, and then identify my patient. I am going to explain the procedure and check for any allergies. I'm going to provide for privacy, so like close the curtain. Then I am going to wash my hands and put on my gloves. Sorry. Okay, and then I'm gonna identify my site. So there's the deltoid. For the deltoid, you would go 3 finger breadths from the acromion process, 2 finger breadths above the deltoid insertion site. Use a 21 to 25 gauge needle for 1 to 1.5 inch needle. And then it's a max of 2 milliliters. For the vastus lateralis, you go a hand breadth from the greater trochanter, a hand's breadth above the knee, insert right in between, 21 to 25 gauge, 5/8 to 1 inch needle, 2 to 5 milliliter max. Split the dose if it's greater than 3 milliliters. And then for the ventrogluteal, you'll palm the greater trochanter, your thumb goes towards the umbilicus, pointer finger goes towards the iliac spine, middle finger goes towards the iliac crest, and then you insert in the V between the middle and index finger, 21 to 25 gauge, 1.5 inch needle, 2 to 5 milliliter, but split the dose if it's greater than 3 milliliters. And then we just don't do the dorsogluteal because you can hit the sciatic nerve. So I'm gonna identify, I have about 1 milliliters I'm gonna be injecting, and so I can do the deltoid, and that's how I pick what site I'm gonna use. So I am going to do 3 finger breadths below the acromion process, 2 above the deltoid insertion site. I'm gonna cleanse this site with an alcohol pad in a circular motion and just leave it there so I know where I'm gonna inject. Then I'm gonna uncap this, move my pad. I'm gonna pull the skin taut, insert at a 90-degree angle, aspirate for blood, fully inject, pull it out. I'm gonna scoop cap it, but if I wasn't reusing it, I would just activate the safety. And then I am going to verbalize that I'm documenting the right medication, the right dose, the right route, right time, right location, patient response, and any patient education.